Hi, welcome to AAPI Voice. My name is Lisa Gray. With me is my co-host, a well-respected community and business leader, Grace Lee.
Hi, I am Grace Lee. Lisa and I have been working with the community in the past decade. AAPI Voice is a program to promote Asian American and Pacific Islanders, and also build social, cultural, education, and political bridge between the AAPI community and the community at large. We are very honored today to have the executive team of Association Chinese American, ACA, with us today. Shilin is the president of ACA. Shilin, can you introduce your team to us?
Yes, of course. Thank you. Thank you, Grace, and thank you, Lisa, for this wonderful opportunity for us to introduce the Association of Chinese Americans, ACA, to your audience. Let me first introduce my team members to you. Roland Huang. Roland is our current board member and also our immediate past president.
Hello, everyone.
And then I have Sharon Gao. Sharon is our vice president.
Hi, how are you, everyone?
And I also have our executive director, Joyce Yihong Lee.
Hello, everyone.
Thank you, Shenli. The Association of Chinese American, Inc., ACA, started in Metro Detroit in 1972. Can you give us a brief overview of your history and why it was started?
ACA is a nonprofit 501c3 organization. We are the Detroit chapter of OCA, Asian Pacific American Advocates. We have a network of 50 chapters across the nation. Our mission is to advance the social, educational, political, and economic well-being of Chinese and API community in the United States. And a little bit about our history. You know, back in the 70s, even with the passing of the Civil Rights Act in 1964, and also the Immigration and Nationality Act in the following year, discrimination still existed in social welfare programs as well as in economic and educational opportunities. And ACA was created under that kind of environment by a group of community visionaries and volunteers in 1972. The common goal in the community back then was to create a broad-based organization to promote interest in welfare, to seek social justice, to protect civil rights, and ensure economic opportunity for Chinese Americans. And that's why ACA was formed. And in the early years, civil rights and civic engagement were a major focus for us. And then with the growing population and increasing needs of health and social services for the community, the foundation of ACA Service Center was laid.
Thank you, Shilin. ACA has a history of almost 50 years. What were the major milestones, and are there new developments you can share with our audience today so they can know your organization better?
Yes, ACA has constantly maintained service facility to meet the needs of the community. We opened our Chinatown Medical Clinic in the 70s and our drop-in service center in the 80s in Detroit. With the rapid expansion of the community, our capacity soon became limited. So in the late 90s, we became searching for a larger facility that was closer to the communities growing in the suburbs. With support from many donors and corporations, in particular, a large donation made by a generous couple, Mason and Grace Yu, who sold their condominiums and donated $1 million to ACA for this purpose. We took a major step in 2003 to purchase an old Chi-Chi restaurant building in Madison Heights and convert it into a community center. The center is central to the Chinese and other Asian American population. It's also close to retails, senior apartments, small business, and I-75 and some other major highways. And considering all these factors, our center has become a hub of everyday activities for many Chinese in the local area. And the multifunctional building is 10,000 square feet, set on a little over 2.5 acre land. With this addition, we expand our services from 1 center to 4, and we're able to further diversify our service demographic from primarily seniors and immigrants to being all inclusive. And this year, we were able to approach another milestone in having our center, our organization accredited so that we can continue to progress and serve the community at an even higher level.
It sounds like you have been involved in promoting civic engagement since the early years. I know Roland have done a lot of work in that field. Roland, can you share some of your work with us?
Thank you, Lisa. Yes. The watershed case is the Vincent Chin case back in 1982. Vincent Chin was a 27-year-old Chinese American who was beaten on June 19, 1982, and he died about 4 days later on June 23, 1982. He was beaten by a father and auto worker, Ronald Evans, and his stepson, Michael Nitz. And what raised the hackles of the Chinese American community and the Asian American community was the lenient sentence of 3 years probation and $3,000 fine. And that was what led to the outrage in the Chinese American community. I recall getting a phone call from Qin Yi, the Chinese Welfare Council president, calling me as the Association of Chinese Americans president, chapter president at the time. And through a series of meetings about the case, we created the American Citizens for Justice. We were not a national organization. We called upon the OCA executive director, Laura Chin, to create a network of outreach for Chinese Americans and Asian Americans nationwide to support the case. Along with that, we went through 2 civil rights trials that followed the state criminal proceeding that was in Wayne County. And we've moved on with that case to continue to advocate for the civil rights of Asian Americans since that time. We've also been involved with the commemorations, the 20th, 30th, and 35th anniversaries of the Vincent Chin case. And so that has led us to recognize the importance of this case for the recognition of civil rights and civil liberties for Asian Americans just nationwide. I also want to mention that the Association of Chinese Americans has been involved with voter registration, most recently in this during this 2020 election, and the Census 2020. We were a participant in that effort. And also, as part of the national OCA effort, we've been involved in gathering PPE and other supplies, gowns, etc., and distributing them to various hospitals, nursing homes, police departments, and educational institutions, anyone that can use those PPE and gowns, for the frontline workers. And we've also been involved in K-12 education to the extent that the OCA has a curriculum project to try to get more recognition of Asian American history into the K-12 curriculum. And so that's an ongoing program that is involved with the OCA National Office.
That's wonderful, Roland. I understand ACA has a scholarship programs that will received by the community. Would you like to tell us a little bit more about it?
Yes, Grace, certainly. It was back in 1984 when the Association of Chinese Americans started its scholarship program. It was that year when the Westinghouse Scholarships, a very notable scholarship program, was swept by 7 Asian Americans that year. And it was at that time that I proposed to Marcus Chow and the board of the ACA board at that time to create a scholarship program. And so I'm proud, and we as committee members of that scholarship committee are proud to have given out about 800 recognitions and 250 scholarships worth about $180,000 over the last 37 years. It's an ongoing program, and we're very proud of the scholarship program. It's a keystone program of the Association of Chinese Americans.
Wow, you have a long history, and it looks like you have done a lot of work. Let's watch a video highlighting the programs ACA has done in the past. Then we will come back to talk about specific programs.
ACA.
And I'm going to take you through the culture, history, food, and fun things about Taiwan. And that was pork trotters. So this is called zhujiao, pork trotters. Wow, look at her place them. She even has some fire, and I think it creates pressure and kind of like a suction, like a vacuum. Let's look at what our teacher is writing. 仁义礼智信.
"后来啊，乡头是一方矮矮的粉末，
就算过节。
Brian? Where do sticks come from?
Cheese. Cheese. Tree.
Thank you, Esther. Thank you.
做一道蔬菜的料理。
讲解中医角度如何在这种特殊时期提高我们的免疫力，还有
如何在秋季里养生。
Welcome everyone for joining us tonight for the workshop. For
《
AAPI Voice. We will continue our conversation with the ACA about their specific programs. One thing we know that is unique about ACA is that you provide day-to-day services covering 4 counties. I know Joyce is the person who's actually handling this portion of the work. So Joyce, can you share more about that? What services do you provide and where can people find them?
Our service covers William, Oakland, Macomb, and Washington counties. We offer many year-round services to Chinese and Asian Americans in the region through our 4 service locations. Our service scope is quite broad. It covers community events and activities, prevention care, children and youth activities, senior living, social and public services, special classes, and workshops. In particular, our social service staff have all got training and are licensed to provide Medicare, Medicaid assistance, and also for Affordable Care Act. This is something that sets us apart. We also run health seminars, recreation and exercise activities, choir classes, Tai Chi, nationalization services, health screening, and much more.
Hi, Joyce. Are there any new programs you want people to know about it in particular?
Yes, they are. We are always developing and expanding our programs. In the last 2 years, we launched a women club that meet at our Canton Center and has been very successful. This program is an example of how we are working to expand our reach outside of senior and youth to impact middle-aged population as well. We also have a new virtual parent-child education and care program for kids and parents, which is providing a lot of help to families during the pandemic. In addition to the participants, this program is also engaged all the youth, like high schoolers and college students, who are helping the program as interns. It is a way we emphasize leadership development for youth, which is one of our goals, like Sharon shared.
Wow, you have done lots. Like other organizations, has the ACA been providing COVID-19 relief to the community? Can you share with us what you have done so far, Joyce?
Lisa, thank you for this great question. At the beginning of the pandemic, ACA quickly sprang into action by setting up a COVID-19 relief committee made up of staff, board members, and the local health and business experts. The committee helped us respond to the community needs and adapt in an innovative ways. We delivered care packages to families, donated PPE to frontline workers, translated health resources, held workshops, and much more. Since the outbreak, even though our service centers are closed, we still offer almost all our activities and services like social services, ESL courses, and recreation classes in virtual settings. Last week, we had an online health seminar with more than 400 participants.
That's wonderful, Joyce. Are you planning to reopen your centers soon? How will you prepare your facilities for the reopening? And are there any future plans you are working on?
We strive to improve our facilities. Currently, we are working hard to prepare our centers to eventually open in a safe and responsible way. For example, supported by grant funds, we are in the middle of a renovation project in our Chinese Community Center to make sure our program, our center meet and even exceed the standards. So this year, we went through a formal accreditation program and in-depth process that allowed us to standardize our policies and practices to ensure that all our services are of the highest quality. We are flexible and adapted in order to improve our online delivery and presence. We're connecting with more people over social media, our website, online videos, and Zoom classes. As part of this process, we are aiming to enhance our image to our outside community, which means going beyond the Chinese Americans to reach more Asian Pacific Americans and becoming more visible in the mainstream community.
Hi, Sharon. We all know it is very important to be inclusive in providing services to the community. Are there any successful examples showing your efforts in reaching out to diverse population over the years?
Thank you, Grace. This is such a wonderful question. Most of ACA programs and activity are designed towards that direction, but today we can use our B3 Leadership Summit program as an example, since diversity and inclusion are exactly the core strategic objective when designing the program. So what is the B3 Leadership Summit program about? The program was launched in 2009 by our national group. It is a professional and leadership development program for aspiring our APIA professionals who are interested in taking their professional and personal goals to the next level through leadership development and networking. So you may also ask what the name B3 stands for. Here it is: build, breakthrough, and believe. It's the three-word mantra of the B3 program and are used as building blocks for the event agenda. So we thought this is a very wonderful and inspiring and aspiring program, so we decided to introduce the program into Detroit in 2016. And since then, every year, it brings together aspiring APIA professionals from the Metro Detroit area. Our B3 speaker team is joined by subject matter experts and professionals from various industries and fields, from mainstream and more than 10 APIA communities, from our local as well as other states. Therefore, across communities, across professionalisms, across geographies, and across ages is how I would describe our B3 speaker team as well as our audience. And that's what makes our B3 Leadership Summit program special, strong, and popular.
Wow, sounds like a wonderful program. Due to the pandemic this year, have you done anything like this?
Absolutely. This year, due to the pandemic, the B3 Leadership Summit was a virtual 2-night program, cover a thought starter presentation, panel discussions, and a new career planning program, including resume coaching and career advising sessions. And even more unique and special, we had a phenomenal international speaker join from Asia to give a very inspirational presentation. So it was such a wonderful experience and with the program. We know this is a very unique opportunity for us to nurture the extraordinary professionals in our community. So moving forward, the B3 Leadership Summit program is becoming one of our annual signature events starting this coming year as part of our education, professional and leadership development, and community outreach programs. So more than just to strengthen the existing B3 Leadership Summit program, we are also planning to connect it with our current high school scholarship program, APIA Youth Leadership Training Program, and even our summer camp counselor training curriculum. So we are very excited about this new coming plan. And with all these goals and objectives in mind, we want to help our APIA community friends to set and achieve their career goals and pursue career opportunities. We also want to provide our APIA community friends a platform to interact with peers and friends who are on their journey to scale their professional as well as personal development. As a word, we want all this done through our wonderful ACA programs.
Thank you so much for your efforts in serving the community. Shirley, any final thoughts to our audience?
Yes, Lisa and Grace, thank you very much for this opportunity. We are thankful that ACA has been able to take on this worthwhile journey to serve the community and has impacted so many lives. No matter where you were born or where you are originally from, ACA welcomes you. With the support from our community, we will continue to carry out our mission with passion and professionalism. And thank you for having us today. I wish that I can meet you sometimes at our centers.
Well, thank you all for these very informative and engaging discussions. And also thank you for the great work you have done in the past decades. And we are looking forward to continue to work together and for the benefit of the community. Thank you.
Yes, absolutely. Thank you all very much for taking the time to be on AAPI Voice. Thank you. For everyone watching, thank you very much for joining us. Please subscribe to our channel and see you next episode.